Thank you, everybody, for being here today. Sorry to keep you waiting. My name is London Breed. I'm mayor of the City and County of San Francisco. I am joined by the Director of the Department of Public Health, Dr. Grant Colfax, and the Department of Emergency Management, Mary Ellen Carroll, as well as our Assessor Recorder, Carmen Chul, and Dr. Aragon from the Department of Public Health. We're here to talk about the coronavirus in particular. As I said, in every single instance, this is an evolving situation, and it is important that we communicate on a regular basis with the public every single day. As you all know, and as we have said time and time again, there have been no confirmed cases in San Francisco. No new infection, and while we know that there continue to be new infections in other countries, we are fortunate that thus far we have had no new confirmed cases. And I'm really proud to work in this city where we've done preparedness work in the past for infection diseases, and I'm proud of the outreach work that our city has done to inform our communities of how to stay healthy. The Department of Public Health has truly been a leader in this effort. My office has been especially focused on working with departments and with our immigrant communities where we know there is a lot of fear. But while I'm proud of the work that we have done, we are at a point where we will need to do more. With the continued rise of the coronavirus across the world, we need to allocate more resources to make sure that we are prepared. We need more help to do outreach to the community and to put those resources to work today. We need to take an official action. And that's why today I'm proactively taking a step to strengthen our preparedness for what may come by declaring a local emergency for coronavirus. In a little bit, we will hear from our Department of Public Health and the Department of Emergency Management about what this actually means. But I want to affirm and reassure our communities that there are no confirmed cases in San Francisco. To be clear, this declaration of emergency is all about preparedness. It's all about preparedness. The CDC has already acknowledged the importance of preparedness in advance of an outbreak. And by declaring a state of emergency, we are prioritizing the safety of our communities by being prepared. While we have no active cases in San Francisco at this time, we are focusing our efforts on protecting the people who live and work here, and we want to be ready for what we anticipate may come our way. Mobilizing our city resources, streamlining staffing, coordinating agencies across the city, allowing for future reimbursements by the state and federal government, and raising awareness throughout San Francisco about how everyone can be prepared in the event that the coronavirus appears in your community. And moving forward, we want to make sure that our residents continue to live their daily lives. There is no recommendation to cancel social gatherings at this time, and we should continue to support the neighborhoods we love, like Chinatown. I went to Chinatown just last week, and I know our speaker, Nancy Pelosi, was there yesterday, and I encourage everyone to continue to visit Chinatown and to support our Chinese community. It's an amazing neighborhood, and we will continue to be very supportive. The doctors here will cover specific advice on how to take care of yourself, but I want to remind everyone to wash your hands with soap and water for at least 20 seconds, to stay home if you are sick, to get your flu shot to protect against flu or symptoms similar to the coronavirus. And if you have recently returned from a country with ongoing coronavirus infections, monitor your health and follow the instructions of our public health officials. Our #1 goal is health and safety of all of our residents. And we are continuing to prepare and to take this incredibly seriously. And we are continuing to be transparent as possible as the situation evolves. And that is specifically what we said we would do, and we will continue to do that. Now, at this time, I want to take the opportunity to introduce Dr. Grant Colfax, who will provide more specifics, and then we'll hear from others.
Thank you, Mayor Breed. I'm Dr. Grant Colfax, Director of the Department of Health. Today, the City of San Francisco is taking aggressive steps to bolster preparedness for the potential arrival to our community of the coronavirus. Our action is proactive and is based on the evolution of the disease globally. Although we do not have any confirmed cases of coronavirus among San Francisco residents, we cannot afford to be unprepared if circumstances change. Here's where we are now. There are no confirmed cases of coronavirus among San Francisco residents. If that changes, we will make that announcement. We have treated 3 confirmed cases of patients from other counties in San Francisco hospitals, and we have informed the community and the press about that. We are monitoring hundreds of people who have recently returned from travel in mainland China and are helping them to self-quarantine and watch for symptoms. To date, there have been no positive cases from that group. Here is what we know. Given the high volume of travel between San Francisco and mainland China and the spread of the virus to other countries, there is a growing likelihood that we will see cases in San Francisco. We are absolutely committed to keeping the public informed if that happens. We have always known this to be a rapidly changing situation. We have been working closely with the CDC, the State Health Department, and other local jurisdictions to stay up to date on all developments. We use that information to continually improve our preparation and response. The Health Department has already been working with elected officials, other city agencies, the city's health system, schools, businesses, and community organizations to ensure that we are all well-informed and prepared to respond and mitigate the harm of the new virus if it emerges in San Francisco. We have been working especially closely with the Chinese community here, which is the most impacted by the illness that is affecting friends and families overseas and causing worry, and by the stigma and discrimination they are experiencing here. Let me be clear. This virus is not about race, ethnicity, or culture. The risk of getting coronavirus is based on travel history and contacts with people who are sick. We know that discrimination causes bad health outcomes. In the case of an emerging illness like coronavirus, stigma may make people less likely to come forward and get help and ask questions. This makes it harder to fight the disease and preserve community health. Fear is a deadly epidemic. We must join together to reject it and to keep our work based on science and facts. Here's why we're doing this declaration today. We must be as prepared as possible. We have been working diligently to keep San Francisco safe and healthy ever since the illness first surfaced in China in December. We activated our Department of Operations Center on January 21st, and the city strengthened these efforts by opening the Emergency Operations Center on January 27th. Today's declaration, and thank you, Mayor Breed, today's declaration is an additional tool. It will mobilize resources, accelerate emergency planning, streamline staffing, and coordinate agencies across the city. Importantly, and I can't stress this enough, it will allow for future reimbursement by the state and federal governments and raise awareness throughout San Francisco about how everyone can prepare in the event that coronavirus appears in our community. This is not business as usual. We are looking at a global outbreak that has entered a new phase. It is incumbent upon the department and all of us to take the necessary steps to protect our community. As you know, San Francisco has never shied away from confronting potential or actual health threats in our city. We did it for HIV/AIDS, and we have continued to respond to outbreaks, including recently the H1N1 flu. We have a strong healthcare system, world-class providers and researchers, and motivated residents that care about health. These are key ingredients for addressing any health threat and to ensure we are protecting our families, neighbors, communities, and city. Thank you.
Thank you. And now I want to call up the Director of the Department of Emergency Management, Mary Ellen Carroll.
Thank you, Mayor Breed and Dr. Colfax. San Francisco plans for, responds to, and recovers to emergencies as a community. Since the outset of COVID-19 or coronavirus, as it's known, the public health and emergency management have been working very closely together. Our operations centers have been activated for over 6 weeks. And as Dr. Colfax noted, we have been working closely with the community to ensure that the people we serve can stay informed and stay healthy. Together, we have hosted community roundtables, demonstrated our support for neighborhood businesses, and very importantly, denounced xenophobia and discrimination. With today's emergency declaration, we are taking this partnership to a new level. As we elevate the response in our Emergency Operations Center, we will establish, and we have established today, a community branch that will consist of community, faith, business, and education partners. As a result, community and government will work together to identify and coordinate our response to this emerging threat. As we expand this operations center, we will also accelerate the development of emergency plans should COVID-19 or coronavirus emerge in San Francisco. Finally, I just want to emphasize that today's emergency declaration is all about preparedness. As a city, we are continuing our posture of leaning forward to anticipate issues, evaluate options, and identify all the resources that we may need to fight this threat. Thank you very much.
Thank you. I now want to ask our Assessor Recorder, Carmen Chu, to say a few words.
Good afternoon. My name is Carmen. I serve as San Francisco's assessor, and I know that I stand here representing a number of individuals to say my thanks to both Mary Ellen Carroll as well as Dr. Colfax and our mayor for taking this step. One thing I do want to emphasize is the importance and our commitment to ensuring that we provide transparency and openness in everything that we know and all that we are doing to combat COVID-19. One of the things that is incredibly important that we have seen across countries and so on is making sure that we are open, that we continue to communicate, and that we share all relevant information. I think today's press conference is one step in that direction to make sure we continue on that commitment. The second thing that I want to make sure that we speak about is the importance of today's event, the importance of drawing the resources and making sure that as a community, as a city, we are prepared, that we have the ability to draw on additional funding, that we have the ability to coordinate across organizations, that we're able to mobilize our city to make sure that we can face and be ready for anything that comes our way. This is something that is incredibly important, and I'm very, very thankful that we're taking that step to move forward. The final thing that I will say, as an Asian American elected, as a person who has immigrant families, who has grown up here, is to make sure that we all remember and do not forget that this virus is not a race-based virus. We have seen it, we have felt it in the Asian American community when people look at someone who has coughed on the bus, when we see children on the playground and our own friends have looked at us a different way. Don't forget, at the end of the day, this is, again, not a race-based virus. Let's not forget about the importance of making sure that we're appropriately responding and that we all do our individual parts not to promote xenophobia. So again, I simply want to say that I am very much in support of what is happening here today to make sure that San Francisco is as prepared as possible, that I want to reiterate our commitment to transparency and making sure that we share with you all information that we have so the public is well aware of all that we are doing. And again, a reminder that at the end of the day, this is not something that is a race-based disease. This is something that we need to treat seriously, and we also need to make sure that we're watching our own actions. Thank you.
Thank you. And our final speaker will be Dr. Aragon from the Department of Public Health.
Good afternoon, everyone. My name is Dr. Tomas Aragon. I'm the health officer of San Francisco. And I've been around for some time, and so I was here back in 2003 when we had the initial SARS, 2009 when we had the influenza pandemic. And based on everything that we've learned, what we're doing today is the right step. I'm so proud to be part of a city that's really leaning into preparedness and doing everything we can to keep our citizens and visitors of San Francisco healthy. We know that while the risk in San Francisco is low, and we're not making recommendations to cancel events or cancel mass gatherings, we know that globally we have a threat, and we're seeing what's happening in other countries. And so the step that we're taking today is putting us in the best position to be able to protect our residents and visitors of San Francisco. We know that currently there's over 80,000 confirmed cases, almost 3,000 deaths. And we know that there's been spread to almost 30 other countries. While the cases in the United States, now numbering 53, the vast majority of them were infected overseas, we know that that can change at any moment. So as a system, we're working to become prepared. We're following very closely CDC guidelines. CDC gives us a framework for how to think about this problem so that we can adapt to the evolving situation. We focus on those areas where we believe there could be more transmission, but also where residents are more vulnerable. So you'll hear us focusing, for example, on schools and children, because we know in schools we know that with children, they may have difficulty with some of the infection control precautions that we talk about. We also know that we're going to be focusing on congregate living situations where people are living close by, where they may be sharing bathrooms and kitchens, and we need to be able to take care of them and be able to help them should they need any help. And then the other important area where there's a high risk of transmission is with healthcare workers. If you think about healthcare workers, where they're seeing a lot of patients, they really have, they're a much higher risk than the average person because they have contact with people who are symptomatic. And so that's why we're prioritizing making sure that they have the tools that they need to stay healthy and to keep us healthy should we become sick. One question I get asked is, how does this differ from influenza? Well, with influenza, the flu, we have a vaccine and we have a treatment. With this novel coronavirus, we don't have a vaccine and we don't have a treatment. So we're going to depend on a lot of core traditional public health measures. Things like washing your hand, making sure that you don't touch your face and your nose, making sure that if you're sick, you stay home from school, from work, or from social events. It's going to be those types of strategies that if we all work on collectively, that we're going to make a difference. And we know from the science that's been done, primarily with the H1N1 pandemic, that these types of strategies, which are called community mitigation measures, make a difference. And so we do have a body of science that's going to guide us. And part of the art is sort of figuring out how to do this, but it only can happen when we work closely with the community, the public, businesses, schools, the media. We need everybody to be on board with us. So those are my key comments. Thank you so much. Again, I'm really proud that we're San Francisco, and I think we're really showing the rest of the country how to do this correctly. Thank you.
Thank you, Dr. Aragon. And are there any questions about the comments that you heard today? All right. Question?
Yeah. So this emergency declaration, we've heard that it allows you guys to mobilize faster. What specific steps does that mean? Are we going to see more doctors in the hospitals? Are we going to be seeing any steps that we'll notice?
Well, I'll let Dr. Colfax talk about that, because it'll be mostly an investment in the Department of Public Health to expand its resources.
Thank you for that. So what this allows us to do, in addition to drawing down federal resources, it allows us to streamline staffing and pull staff from other non-essential duties in order to do more focused work on this vulnerability that we currently have. So things like working directly with the Chinese community, ensuring that we have public health nurses, case managers, social workers, and so forth assessing situations. We want to be as prepared as possible. It also allows us to mobilize more clinicians and our medical expertise in order to focus specifically on this. So for instance, as we prepare for a greater number of questions, clinical questions about what can I do, that we have clinicians on call 24/7 in order to respond to that. It also allows us to pull more staff that have language skill sets in order to better and more fully educate the community. Along with the Department of Emergency Management, it allows us to look at things like shelters and other opportunities for us to expand in the event that that's necessary, and do a broader assessment of the city's capacity to respond in the event that there is an outbreak of coronavirus in San Francisco. This work is essentially what one does in the face of a high-risk situation. So we have the skill set, we've done this work before, but this is the tool that we need now to be as proactive as possible, to be prepared as possible, so that we have the tools necessary to respond if and when coronavirus does come to San Francisco.
My question was also about the timeline. In other words, did this come following news of the outbreaks in Italy and in Iran? Did it come following the progression of the disease?
So I think exactly. We have seen in the global arena, especially recently over the weekend, we saw in some countries where cases went from a very few cases to multiple cases in a very rapid period of time. So rather than waiting, we thought it was very important that we mobilize and use the tools we have at our disposal now to be as prepared as possible, to make the investments now to be as prepared as possible, and to be as transparent as possible with the community, with the press, with regard to why we are doing this now, and to provide all information on a regular basis. As things evolve, we will certainly are committed to updating the community and all of you.
Dr. Colfax, do you mind, what is the current status of the 3 people that are
So I'm unable to share that specific information, except to say that those 3 people at last report were doing well, and that's all I can say at this point.
The only number you can call is...
So 311 is the number to call now, but I will say that we have a triage system that if people are specifically calling about concerns around coronavirus, that they are referred to an expert on that. And if they have clinical questions, there's a clinician that available on call 24/7 to answer those questions.
Colfax, how many available hospital beds with negative pressure rooms are available in the city of San Francisco?
So across San Francisco, we have more than 100 negative pressure rooms, and we have multiple other hospital beds that could be used if necessary. But I want us to emphasize that we have no newly diagnosed coronavirus in San Francisco We have a robust medical system, over 100 beds, and other hospital beds could be made available if necessary.
Is that between multiple hospitals?
That's across our system at this time.
What's been the impact of stigma on the Chinese community and Chinese businesses in Chinatown?
Thank you very much for that question. We have yet to quantify what that impact has been, but I think many of us feel it and can see it whenever we go out. I think we see many of our restaurants, not only in Chinatown, but across our neighborhoods, that are sitting empty on days that would normally be filled to the brim with people who were going there for eating. We see when we go on Muni or different locations, we see people who are looked at a different way when they cough, simply because they're clearing their throat. We see that there are instances where children, even at schools, are being picked on, or that is being said about their community and their culture. So I want to make sure our message today is really about preparedness. It is about making sure that we're open with you about all the statistics that are coming out. But in addition to that, we also want to share a message of making sure that we don't let this disease turn us into racists. At the end of the day, again, this is about contracting a virus because someone traveled. When I cough and I haven't traveled to China for 10 years, it is completely a different situation. And so I just want to, again, emphasize that the impact on the Asian American community, not just the Chinese community, the Asian American community is large, it's significant, it's real, and we just hope that people remember the importance of separating the disease from our community.
Have lines of communication been opened with federal officials at this point, and what has their response been, if so?
So we've had regular communication with federal officials across many levels, but particularly and especially with CDC. There are regular calls that are processed so that we have the most current information from the national level, and we're coordinating not only with the CDC but also with other local jurisdictions as well as the state.
Why should people not panic? Why should people not panic?
What was that, Fred?
Why should people not panic?
I think, we have been very open and transparent, as we have said from the beginning, that in every instance, we will notify the public where we are. And so where we are, as was said, there have been no confirmed cases in San Francisco. But the fact is, we are preparing if or when it may happen. And we have a Department of Public Health with a number of experts who have been working daily to ensure that we monitor the situation not only closely here in San Francisco, but globally, so that we can do exactly what we're doing here today, determining that there are more resources needed faster so that we are prepared for any situation. So if there were a major concern, we would talk about that and what that would mean to the public. And so I think providing clear, accurate information on a regular basis is what's critical to ensuring public health and public safety. And I also want to make it clear that our number one priority is public health. It is to ensure public health. And that's why we're here focused on this today.
This question is for Dr. Colfax or Dr. Aragon. Is the flu surveillance network lab testing for COVID-19 and flu negative cases?
I'm sorry, could you, I heard the surveillance part, but could you repeat that question?
The lab testing for COVID-19 and flu negative cases.
The local lab. So right now, all the testing for COVID-19 is being done currently at the CDC. We are hoping and expecting that state testing and local testing capacity will happen. I don't have a timeline to share with you on that, but the CDC has made it clear. And I'm actually very proud that San Francisco, because of our robust system of public health, we will be one of the local jurisdictions that should be able to test early on, but we don't have that specific date yet.